Hello students, Dr. Gaurav is back and this time I focus on the cavernous sinus. So what is the cavernous sinus and where is it located? The cavernous sinus is a large venous space. Well, we have the right and left cavernous sinuses. This is the cavernous side of one side and this is the cavernous side of the other side. The cavernous sinus is a venous space situated in the middle cranial fossa. This is the region of the middle cranial fossa. So the cavernous sinus is situated on either side of body of sphenoid bone. This orange structure you see here represents the pituitary which lies on the body of sphenoid bone. So the cavernous sinus is situated on either side of body of sphenoid bone. It is a venous space. It is 2 centimeter long, 1 centimeter wide, and you know why it is called cavernous sinus? It is called cavernous sinus because its interior is divided into a number of spaces or caverns by trabeculae. So let us do the location in detail once again. So it is situated on either side of body of sphenoid bone. So this is the location of cavernous sinus of one side, while this is the cavernous sinus of the other side. As I said, it is a large venous space. Okay, so it has got an anterior extent and a posterior extent. Anteriorly, it extends up to the medial side of superior orbital fissure, and posteriorly it extends up to the apex of petrous part of temporal bone. So the pointer here is now representing the apex of petrous part of temporal bone. So this cavernous sinus is situated on either side of body of sphenoid bone, and uh, it has got an anterior extent and a posterior extent. Now here we see some other structures also in this figure, like this is optic chiasma. So this is optic tract. So we can now appreciate that how optic tract comes in superior relation to the cavernous sinus. So the cavernous sinus, once again I reiterate, extends from the medial aspect of superior orbital fissure to the apex of petrous part of temporal bone, and it lies on either side of body of sphenoid bone. The two cavernous sinuses are interconnected with each other by the anterior intercavernous sinus. The location is here, and the posterior intercavernous sinus. The location is here, and the orange color here represents the pituitary gland. So what are the other structures we see here in relation to the cavernous sinus? We see the optic tract. This is optic chiasma, this is optic tract, this is optic nerve. So optic nerves unite to form the optic chiasma, and the optic tract is there, right and left optic tract, and each optic tract comes in superior relation to the cavernous sinus. Other structures which we see here are, this is superior petrosal sinus, this is inferior petrosal sinus. On the other side, this is superior petrosal sinus, while this is the inferior petrosal sinus. This is the basilar plexus of veins, and this is the foramen magnum. So I think now the location of the cavernous sinus is clear to you all. So it extends from the medial margin of superior orbital fissure to the apex of petrous part of temporal bone. Now let us see the osteological landmarks in relation to the cavernous sinus. As I mentioned, it extends from the medial margin of superior orbital fissure. This is the location of superior orbital fissure to the apex of petrous part of temporal bone. So this bone here, students, is the petrous part of temporal bone, and here is the apex of petrous part of temporal bone. So here lies cavernous sinus of one side, while here lies the cavernous sinus of the other side. Okay, and as I mentioned, it is a venous space. So on the medial aspect is lying the body of sphenoid bone. And what is resting on the body of sphenoid bone? You have the pituitary gland or the master endocrine gland. And on the lateral aspect of the cavernous sinus is the temporal lobe of the brain. Okay, so anteriorly medial aspect of superior orbital fissure, posteriorly up to the apex of petrous part of temporal bone. Medially you have the body of sphenoid bone. Laterally you have the temporal lobe of the brain. So these are the relations of the cavernous sinus. And what do we find here? You see here, students? Yes, along this margin lies the incoming channel of the cavernous sinus, which is called the sphenoparietal sinus. And the cavernous sinus also has drainage channels, and one of them lies on this groove. You see a groove here on the superior surface of apex of petrous. From the apex of petrous part of temporal bone, it is going like this. On the superior surface of petrous part of temporal bone, we have a groove for the superior petrosal sinus. And this groove here is for the inferior petrosal sinus. So superior petrosal sinus and inferior petrosal sinus, they represent the drainage channels of the cavernous sinus. And here we have the sphenoparietal sinus along the margin of the lesser wing of sphenoid bone. So these are the osteological landmarks in relation to the cavernous sinus. So boundaries of the cavernous sinus, the anterior extent I have mentioned already up to medial end of superior orbital fissure, while the posterior extent is up to apex of petrous part of temporal bone. Then the floor is formed by endosteal dura mater, while the lateral wall, medial wall and roof are formed by meningeal dura mater. Now students, you have to keep in mind that the dura mater has got two layers. It has got a endosteal layer and a meningeal layer. So how these two layers are coming in relation to the cavernous sinus? Now you see the blue structure here. This is the cavernous sinus, and this represents the endosteal layer of dura mater, which is coming in relation to the floor of the cavernous sinus, while the lateral wall, medial wall and roof, they are formed by the meningeal layer of dura mater. So dura mater has got two layers, endosteal layer and the meningeal layer. Endosteal layer is coming in relation to the floor of the sinus, while the meningeal layer is coming in relation to the lateral wall, roof and medial wall of the cavernous sinus. Now I have already mentioned that superiorly the cavernous sinus comes in relation to the optic chiasma and the optic tract. It also comes in relation to the anterior perforated substance. And now if you concentrate on this diagram, students, here the yellow structure represents the superior orbital fissure. Okay, and this foramen with irregular margins, it represents the foramen lacerum. This oval foramen is the foramen ovale, and the foramen behind this foramen ovale is the foramen spinosum. While this yellow foramen, rounded foramen, represents the foramen rotundum. So since the cavernous sinus extends from medial aspect of superior orbital fissure to the apex of petrous part of temporal bone, it is lying somewhere around here. Okay, and now you can make out from this diagram that the foramen lacerum comes to lie in relation to the inferior aspect of the cavernous sinus. Here we have the junction of body of sphenoid with the greater wing. So this is the area of body of sphenoid and this is the greater wing. So this also comes in relation to the floor of the cavernous sinus. And lateral to the sinus, somewhere around here, comes the temporal lobe of the brain with the uncus, as I have already mentioned. So medial relations of the cavernous sinus, here we can make out that you've got the pituitary gland here and the sphenoidal air sinus inside the body of sphenoid bone. Anteriorly and posteriorly I have already mentioned. Anteriorly is medial aspect of superior orbital fissure and the apex of orbit, while posterior relations are apex of petrous part of temporal bone and the crus cerebri of midbrain. Now students, the structure in the lateral wall. So what are the structures in the lateral wall? You see these yellow structures? They are nerves in the lateral wall of the sinus. So the structures in the lateral wall of the sinus and structures in the center. Now these two are the structures in the center. They are separated from the blood in the sinus. The blue one is the cavernous sinus by the endothelial lining. You see the dots here? They are representing the endothelial lining of the cavernous sinus. So the cavernous sinus is lined by endothelium, and that endothelium is separating it from the nerves in its lateral wall. These are the nerves in the lateral wall. We'll come to them later on. And this endothelial lining also separates the structures lying in the center of the sinus, these two structures, from the blood in the cavernous sinus. So what are the structures in the lateral wall of the cavernous sinus? This is the key diagram of this topic we are dealing with today. So from superior to inferior side, from superior aspect to inferior aspect, you have the third nerve or the oculomotor nerve, the fourth nerve or the trochlear nerve, then the trigeminal nerve has got three divisions. So out of these three divisions, the ophthalmic and maxillary divisions are lying in the lateral wall of the cavernous sinus. And suppose my hand is representing the lateral aspect of the cavernous sinus, then its posterior aspect of the lateral wall is indented by the trigeminal ganglion. Now my fist is representing the trigeminal ganglion, which indents the posterior aspect of the lateral wall of the cavernous sinus. Okay, so these are the structures which are lying in relation to the lateral wall of the sinus from above down. Now, what happens to these structures in the lateral wall of the sinus? That is important to understand. Now, in the anterior aspect of the lateral wall, the third nerve divides into two divisions. That is the superior division and the inferior division. Now, you can make out this is superior division and inferior division. This, students, is the superior orbital fissure. Okay, so this is the lateral aspect, central aspect, and the medial aspect of the superior orbital fissure. And this is the common tendinous ring for the recti muscles. Okay, and this is the optic canal. So the oculomotor nerve, which is lying in the lateral wall of the sinus, it divides into its two divisions, superior division and inferior division, in the anterior aspect of the cavernous sinus, and these two divisions, they leave the sinus and enter the orbit through the middle part of the superior orbital fissure. Now in the lateral wall of the sinus, from superior to inferior aspect, we had oculomotor nerve and then we had the trochlear nerve. So trochlear nerve lies inferior to oculomotor nerve in the lateral wall of the sinus. Now near the anterior part of the sinus, the trochlear nerve, it crosses and becomes superior vis-a-vis in relation to the oculomotor nerve. So that this trochlear nerve, which was initially lying inferior to oculomotor nerve in the lateral wall of the sinus, it becomes superficial to the oculomotor nerve in the anterior aspect of the sinus, and then it leaves the it leaves the cavernous sinus and enters the orbit through the lateral part of the superior orbital fissure. So in the lateral wall of the sinus, the third nerve was superior initially, but then in the anterior aspect of the lateral wall, the fourth nerve becomes superficial to the or superior to the third nerve, and the fourth nerve now leaves the cavernous sinus and enters the orbit through the lateral part of the superior orbital fissure. Now, ophthalmic division of trigeminal nerve, it divides into its three branches in the anterior part of the lateral wall of the cavernous sinus, and the three branches are lacrimal, frontal, and nasociliary. Lacrimal and frontal, they leave the sinus and enter the orbit through the lateral part of the superior orbital fissure, while the nasociliary enters the orbit through the central part of the superior orbital fissure in between the two divisions of the oculomotor nerve. And then we have the maxillary division in the lateral wall of the cavernous sinus. This division, students, it leaves the skull by passing through this foramen rotundum. You see the foramen rotundum here, and then it goes into the pterygopalatine. Now, structures passing through the center of the sinus. Okay, so before doing the structures passing through the center of the sinus, structures in the lateral wall of the sinus, oculomotor nerve, trochlear nerve, ophthalmic division of trigeminal nerve, and maxillary division of trigeminal nerve. This maxillary division of trigeminal nerve leaves the sinus by passing through foramen rotundum to enter into the pterygopalatine. So These are the structures in the lateral wall of the sinus. In the anterior part of the lateral wall, oculomotor nerve divides into its two divisions. In the anterior part of the lateral wall, the trochlear, which was lying inferior to oculomotor, becomes superior to it. In the lateral part, the ophthalmic division divides into its three branches. Okay, and the maxillary nerve in the anterior part of the lateral wall, it passes through foramen rotundum to enter the pterygopalatine fossa. Now, these two structures here are said to be lying in the center of the sinus. Why they are said to be lying in the center of the sinus? Because you see here they are surrounded by the venous blood in the sinus. So it appears as if they are passing through the center of the sinus. So what are these two structures? They are the internal carotid artery and the abducent nerve. So we say that these structures pass through the center of the sinus. Now this diagram, students, you have to practice time and time again. I told you before also, this is the key diagram of the region, and this represents the coronal section of the middle cranial fossa. So you keep on practicing it again and again until you become perfect in this diagram, because this diagram, if you know, then only then you can explain and understand the anatomy of the cavernous. What are the factors which are helping in expulsion of blood from the sinus? One is the expansile pulsations of this artery, which is a very important artery, the internal carotid artery. Other is gravity, and then of course the position of the head. We keep on changing the position of the head. That also helps in expulsion of blood from the sinus. So it's a venous sinus, so it requires gravity and change in position for expulsion of the blood, and the arterial pulsations also help in the expulsion of venous. Now this cavernous sinus has got incoming channels or tributaries, and it also has drainage channels. Before we go into the incoming channels and drainage channels, I think it is very pertinent to keep in mind that whether it is incoming channel, whether it is drainage channel, both these communications, they are valveless. So blood can flow in either direction. So this is very important, that we are going to do now the incoming channels or the tributaries which are entering the cavernous sinus, and the outgoing channels or the drainage channels of the cavernous sinus. But the thing which is important to remember here is that whether it is an incoming channel or it is an outgoing channel, the communication is valveless, so blood can flow in either direction. So keep that in mind. Okay. So what are the incoming channels into the cavernous sinus? Now this blue box here is representing the cavernous sinus. Now you see 1A, 1B, 1C. Now they represent the incoming channels from the orbit. They are respectively superior ophthalmic vein, inferior ophthalmic vein, and 1B represents the central vein of the retina. So all these are mentioned here. So they are the incoming channels from the orbit. So the second source of incoming channels is brain. So we have two veins here represented by 2A and some veins represented by 2B. So 2A represents the superficial middle cerebral vein, which is an incoming channel into the cavernous sinus. Along with superficial middle cerebral vein, you have some inferior cerebral veins, and they also enter into the cavernous sinus. And the third source of incoming channels into the cavernous sinus is from the meninges. So from the meninges we have 3A, which represents the sphenoparietal sinus. I showed it to you previously on the bone also. And we have the frontal trunk of middle meningeal vein represented by 3B, which also enters the cavernous sinus. So we have three sources from where incoming channels or tributaries enter the cavernous sinus. So this diagram also you need to practice. And let us look at this diagram again carefully. So we have got the incoming channels from the orbit, superior ophthalmic vein, inferior ophthalmic vein, central vein of retina. We have got the incoming channels from the meninges, okay, and we have got the incoming channels from the brain. So we have got this 2A, 2B, 2B is representing the inferior cerebral veins. Okay, we have got 3A is representing the sphenoparietal sinus, and 3B is representing the frontal trunk of middle meningeal vein from the meninges. And 2A is representing the, what does the 2A represent? It represents the sphenoparietal sinus. Okay. Then we have some outgoing channels also, which are very evident here in this figure. So what are the outgoing channels? The outgoing channels which we can appreciate here, one is the superior petrosal sinus. So this superior petrosal sinus is draining into the transverse sinus. And then we have the inferior petrosal sinus, which is draining into the internal jugular vein. Okay, so we have superior petrosal sinus and inferior petrosal sinus, which are drainage channels visible in this diagram. And then we also have emissary veins. Now these veins are passing from the cavernous sinus and they are going into this black box, which is representing the pterygoid plexus of veins. Okay, so emissary veins from the cavernous sinus, they pass through foramen in the skull and they have communications with the pterygoid plexus of veins. So we see the drainage channels here: superior petrosal sinus, inferior petrosal sinus, and through emissary veins into the pterygoid plexus of veins. The venous blood can go. So we have incoming channels as well as drainage channels here. Let us see the incoming channels again: superior ophthalmic vein, inferior ophthalmic vein, central vein of retina. Then we have from the brain superficial middle cerebral vein, inferior cerebral veins. Then we have from the meninges sphenoparietal sinus, and then we have from the meninges frontal trunk of middle meningeal vein. And the drainage channels, the cavernous sinus is draining through superior petrosal sinus into the transverse sinus, and through inferior petrosal sinus into the internal jugular vein, and through emissary vein into the pterygoid plexus of veins, which are veins which are present in relation to the pterygoid muscles. So this black box here is representing the pterygoid plexus of veins. And one more drainage channel we can appreciate here, that the cavernous sinus can drain into the facial vein. We know the facial vein is formed by union of supratrochlear and supraorbital vein. So here you see that blood from the cavernous sinus can pass through superior ophthalmic vein into the facial vein through the supraorbital vein. So this again is a drainage channel. Now again we see the drainage channels here. The blue structure is representing the cavernous sinus on either side, and this is the infundibulum. So what are the drainage channels? Well, through the superior petrosal sinus, the cavernous sinus is draining into the transverse sinus, and through the inferior petrosal sinus, the cavernous sinus is draining into the internal jugular vein. And the two sinuses, the right and left, are also communicating with each other through anterior intercavernous sinus and posterior intercavernous sinus, lying anterior and posterior to the infundibulum of the pituitary gland. Okay, so here we see three drainage channels: superior petrosal sinus, inferior petrosal sinus, and the anterior and posterior intercavernous sinus. Now look at this diagram once again. Here we see the superior petrosal sinus, inferior petrosal sinus, anterior and posterior intercavernous sinuses. And we also see some incoming channels from the meninges, the sphenoparietal sinus, and the frontal trunk of middle meningeal vein. So this diagram, students, you need to practice to get better marks in the examinations. And so kindly don't ignore practicing this diagram. Now we come to the applied aspects of the cavernous sinus, and the clinical importance of the cavernous sinus is due to its thrombosis. This thrombosis in 30% of the cases is even fatal. Okay, now what can be the cause of this thrombosis? It can be a sepsis in the dangerous area of the face. Now, do you remember what is the dangerous area of the face? The upper lip and the lower part of the nose. This is referred to as the dangerous area of the face. Now, even any infection in this area can spread through the deep facial vein into the pterygoid plexus of veins, and from there it can go into the cavernous sinus to cause its thrombosis. That is why even teenagers are advised not to to peel off any pustule in the region of the upper lip or the lower nose, because sepsis can spread in a retrograde manner. So cavernous sinus thrombosis, uh, infection can spread into the cavernous sinus and cause thrombosis there. This infection can spread from the dangerous area of the face, nasal cavities, and the paranasal sinuses. And then once this thrombosis occurs, there are nervous symptoms and venous symptoms. Now the nervous symptoms are due to involvement of structures in the lateral wall of the sinus. So there is pain in the eye and the forehead in the area of distribution of ophthalmic nerve. See, the ophthalmic nerve is lying in the lateral wall of the sinus. So there is pain in the eye and the forehead, okay, due to involvement of the ophthalmic division of trigeminal nerve, which lies in the lateral wall of the sinus. Then due to involvement of the third, fourth and sixth cranial nerves, let us see where the third nerve is here, fourth nerve is here, and the sixth nerve is here. So due to involvement of these three cranial nerves, there is paralysis of the muscles supplied by these three cranial nerves. So these nerves are supplying the extraocular muscles. So that problem is there in case of cavernous sinus thrombosis. There is paralysis of extraocular muscles. And then there are venous symptoms. Now, why would venous symptoms occur? Venous symptoms will occur because there is thrombosis in the sinus here. So what will happen here, that the veins which are entering from the into the sinus from the orbit, they will not, the venous blood will not flow from this part. So what will happen is there is thrombosis in the cavernous sinus, as a result of which there is congestion or there is edema of the veins in the eyelids, cornea, and root of nose. So this edema of the eyelids, cornea, and root of nose takes place due to congestion of orbital veins. And why does this congestion of orbital veins takes place? Because the cavernous sinus is thrombosed. So that is why congestion of orbital veins takes place, and this causes edema of eyelids, cornea, and root of nose. And due to this edema, there is exophthalmos, that is the bulging of the eyeballs, because the cavernous sinus is blocked and there is the incoming channel is totally blocked. So there is congestion of orbital veins. So I've created this cartoon. Um, so I call it inductive toon, and this fellow here is named Innovatio, and he believes in innovations. So what happens is he's the student of science. Now this witch here is very happy, and she says, she tells this guy Innovatio, do you see that thrombosis? And Innovatio says, yeah, that sinus is quite cavernous. He means to say that the sinus is prone to thrombosis. So this has just been created to imprint in your minds the applied aspects of the cavernous sinus thrombosis. So I hope it is successful. Now, other applied aspect of cavernous sinus is pulsating exophthalmos. Now, what is pulsating exophthalmos? Suppose there is a head injury, and in that case, due to the head injury, there may be communication of arterial blood in the internal carotid artery with the venous blood in the cavernous sinus. So this venous blood in the cavernous sinus is in communication with the orbital veins. So due to that, what happens is that the eyeball, it pulsates with each heartbeat. Okay, the heartbeat has its effect on the internal carotid artery. Okay, and due to this artery communicating with the sinus and the sinus having communication with the orbital veins, what happens is that with each pulse there is the eyeball protrudes, okay, and that is called pulsating exophthalmos. So this inductive toon is there, which has been created, in which the girl is asking Innovatio to name the condition in which the eyeball pulsates with each pulse, and Innovatio very smartly, like Sherlock Holmes, he replies, elementary, that would be a case of pulsating exophthalmos. So that brings us, dear students, that brings us to the end of the topic. Thank you for being with me, and till the next time we meet, bye, namaste, and All of you take care. Thank you.